Hey, it's your girl Sarah right here on Relax Radio. You're tuned into the Kaleidoscope, and a very good morning if you're just joining in. And welcome to the second hour of my show. Now, I'll be keeping you company all the way until 9 a.m. So make sure you stay tuned because I have very interesting content coming your way, and I will also be having a lot of very important conversations. So make sure you stay tuned because we're going to be talking about if rest is the recovery to COVID-19. Um, now, if you really like some of the content that we have, if you really like some of the things we're talking about, make sure you subscribe to our content. Make sure you follow us on our socials, which is Facebook, Instagram, TikTok, and Twitter, because you can keep yourself updated on all the very fun and interesting things we talk about. And it will also help you it will also help you be aware about everything that's going on in the world. So make sure you stay tuned for that as well. But right now, the conversation we're having is obviously if rest is a recovery to COVID, and we're also talking about we're also taking questions. We're also taking messages, opinions, anything that you would like me to talk about, anything you would like to share with me. You can do that by just texting me on 07852 473 473. So let's get into the conversation about if rest is actually the recovery to COVID-19. Now, like I said, we need to understand that when the pandemic broke out back in 2019 in Wuhan, China, it was very chaotic. It was very scary, and um, it was a lot of different things. We had to go through a lot of different things. We had to put up with all these different things that were happening in the world, and we're talking about are things completely changing. Our lives went from normal to abnormal in a matter of a few days, because this pandemic broke out and everything in the world was just completely chaotic, and people were struggling to figure out what exactly was wrong. People, or rather scientists, were struggling to figure out the how this disease worked, the pros and cons of this disease, and we were trying to figure out how fast we could get vaccination and if vaccination was actually going to help. But even though it's been almost 2 years into the pandemic, even though we have started vaccinating, even though we've found vaccines, that there's still a lot of questions about. There's still a lot of questions about vaccinations. There's still a lot of questions and a lot of uncertainty as well when it comes to. All the things when it comes to all these questions that are related to COVID-19. So obviously, even though we have come to terms to some extent about the way things have changed and how fast the world has changed, we're still trying to come to terms with it, because even though things are slowly getting back to normal, it's very slow and there is a lot of uncertainty, right? So because of that, we're still in the process of coming to terms with how the pandemic changed the world so much. And in addition to the disease, we've all been stuck at home as well because of because of lockdown, and we've all been very isolated and marginalized. So normal things that we used to do, normal things like going out, meeting your friends, going out for breakfast, coffee, whatever it was, those normal day-to-day things that we did aren't the same anymore. They're not normal. If anything, it's normal because we're all stuck at home. We are isolated. We're very much marginalized, and we have to spend a lot of time with ourselves and our families. And all these things that we used to do, like going out and meeting our friends, we've had to do it virtually. We've had to talk to them through Zoom or video call them, or whatever it is. A lot of these things have changed, and also we've had to work from home. We've had to adjust to this new environment, and we've also had to try and be very, very productive. Even though all of us are going through a huge pandemic, we've obviously have had to try, or rather we've had to find ways in which we can be productive and try to make sure we make the best of staying at home, right? But also at the same time, it has been somewhat of a vacation, or somewhat of a rest for a lot of us who have very busy lives or constantly at work, and who's only home for a few hours of the day. Sometimes some of us don't even come home unless it's for the weekend. So obviously, what this pandemic has done is, if we're looking at it in terms of any of the positive things it's done, is that it's actually brought a lot of people closer. It's made us and our families close, and it has given us the much deserved rest we all needed. So That's the positive side of it. But obviously there's still a lot of fear, there's still a lot of uncertainty and anxiety, because we're very unsure, because we're still very much in the initial stages of the pandemic, right? um Maybe not initial, but we're still not, at the end of it, maybe somewhat in the middle. But obviously there's still a lot of uncertainty, and a lot of this uncertainty is actually about things like, will this pandemic completely end? Is it something we can get completely rid of? Or is it something like, or is it something very seasonal like the flu? Is it something that will come once in a while? Is it something that will cause an outbreak once in a while? So there are these questions that are still there. And also, other questions that are there is, once you get the virus, are you completely cured? Do you still have some symptoms that will affect you for longer periods of time? Will you still have some symptoms that will make you feel very uncomfortable? It might not necessarily result in you being hospitalized, but sometimes, even though you fully recovered, is it a full recovery? Do some of these symptoms appear a few months after you're completely recovered? So there's a lot of questions like that, right? And also, we're scared about our future, we're scared about our businesses, we're scared about our work, because we don't know when exactly we can get back to normal. We don't know when exactly we can change things, and how and when we can meet friends, because even though lockdown is supposed to be lifted next month, we're not too sure about whether it would actually be lifted. Because if things do get worse towards the end of the lockdown period, then chances are it's probably going to be extended again. Now, although it's very hard for us to stay at home, it's very hard for us to be alone at home, especially when things are so routinal, when things are very monotonous. It's completely fine. It's completely fine for you to feel depressed. It's completely fine for you to feel like your life has no purpose, because that's what a lot of us have been feeling, and that is what scientists and other people and other researchers refer to as languishing, which happens to be a very dominant emotion of the past year and also this year as well, because a lot of these countries, even though we're still vaccinating, even though we've gone to great heights with the vaccination process, a lot of other countries are still, in their third waves or in the second waves of the pandemic. Especially poorer countries out there haven't been able to vaccinate whole populations because of the vaccine inequality that exists within the world. And because of that, there is still a lot of uncertainty, there is still a lot of danger and risk as well, that is there with regard to the virus. So, like I said, there is a lot of doubt, there is a lot of questions that we have, and there is a lot of uncertainty about the pandemic. But obviously, it's also very important for us to keep staying positive. And I know it's easier said than done. It's very easy for someone to say, hey, look, be positive, think happy thoughts, forget about all your negative thoughts. Well, it's not always as easy as it's easier said than done. It's not always as easy as someone says it is, right? Because you can have these positive thoughts, you can try, you can force yourself to be happy, but sooner or later you're going to go past your breaking point. You're going to explode, and you're going to realize that I'm not really happy. I'm probably depressed. I'm very lonely, and I have a lot of anxiety about the future. So obviously we have a lot of that. But because vaccinations are happening, a lot of things seem to be slowly getting back to normal. We obviously have this question of whether what, or rather of how it would be like when things do get back to normal, whether we'll be able to go out and meet our friends, whether we'll still have to keep wearing masks, whether we'll still have to maintain these COVID regulations that we're maintaining, like social distancing, wearing your mask, sanitizing. However, it's very important to understand that even if you keep practicing these, it's not harmful. It will actually help you, because research has shown that during the past year, because we were so careful, we were constantly wearing masks, we were sanitizing, and we were social distancing. Flus, how often we can track flus. It's seasonal, things like that have actually reduced. And I saw this meme actually on Instagram as well that said, it's crazy how you can how healthy you are when you actually take care of yourself, and you are more worried about how all the safety precautions that you take, right? Which is very interesting, because if you think back on the things we used to do before the pandemic, you'd realize that a lot of us were really, really gross. We did a lot of really gross things, and we did a lot of very unsafe, unhealthy things that sometimes ended up with us getting a flu, but also sometimes, things didn't happen, but we still understand that back when you think about how we used to live before the pandemic, it was a bit gross. We were all a bit, dirty. If to put it that way, we were all a bit dirty. So like I said, things do slowly seem to be getting back to normal, and we have all these questions. But today, I actually want to talk about how people who've contracted the virus can recover from the virus, whether it's fully possible to recover from the virus, and whether certain symptoms will keep showing up later on after you're supposed to be completely recovered. Because research has found that sometimes, even though you're completely recovered after 2 weeks, usually on an average, that's the time people take to recover, about 2 to 3 weeks. Sometimes, even though you're fully recovered, you can still have some of these symptoms like fatigue, or sometimes a cough, or even sometimes the loss of taste and smell. Those things can happen. So because of that, there is still a lot of research that's being conducted into it. There's still a lot of questions about it. So obviously, because that's the case, it's very, very important that we talk about these things. It's very important that we pay attention to them as well. Now, that's what we'll be talking about today. We'll be talking about how we can actually recover from the virus, if complete recovery is possible, and how to actually make sure you don't contract the disease again, or how you can be so much more careful, right? So stay tuned, because I'll be heading into all of that in a little break. We'll also talk a little bit about COVID-19, because I know it's been a while. It's been a while since we had all these news channels blaring out the symptoms of COVID, talking about what exactly needed to be done, what these symptoms are, and what kind of whether we needed to go and get a test done. So I'll obviously be talking about some of that as well, just to recap on everything. But until then, make sure you stay tuned, because I'll be heading into a small break, and right after that, we will be talking about all of these things.
Now, there's a lot of conversation around who pays more taxes, if it is the rich or if it is the poor, right? But when you are basically going out and during a day, you go to a restaurant, you have to pay taxes there. If you buy a car, you have to pay taxes there. So why is it even a conversation that the rich pay less taxes, or the poor pay more taxes? Why is it a conversation like that?
Because it's true, the rich generally pay less tax. A rich person walks into a Tesco's or a Sainsbury's, they're not going to get a different bill than another person, right? They're still going to pay the same VAT on those goods, they're still going to pay the same thing. So that's all the same. However, the differences come in if you can pay yourself from your own company, you can structure it in a way that you pay less income tax through paying a bit of salary, paying dividends and so forth, and then also deferring income. Also, your pension payments or contributions can be different. So that increases your tax sort of gap, if you want to use it that way. Where a PAYE person just gets paid salary and bonus. And now those are the most highly taxed sources of income in the UK, definitely, in the UK. We've seen it, right? If an owner of a large public traded company does something wrong, irrelevant of what that company does or how valuable that company is, the stock generally falls into a pool of nothing, right? Because in a public company where the stock is traded openly on the stock exchange, the value of that stock is driven by supply and demand, it's driven by emotion, it's driven by news, it's driven by quite a lot of variables over and above the actual accounting or total net worth of that company. I mean, we've seen it, right? If an owner of a large public traded company does something wrong, irrelevant of what that company does or how valuable that company is, the stock generally falls into a pool of nothing, right? And the company may still have value, it may still be doing quite a good thing.
it's your girl Sarah right here on the Kaleidoscope. Now, I'm super excited to be here, and a very good morning if you're just joining in. I have a lot of fun things coming your way, so make sure you stay tuned because I'm very, very excited to be here and tell you about all these things that are happening in the world. Now, if you're just tuning in, what we were currently or what we were talking about right now is was actually if rest is a way in which you can completely recover from COVID, and if there are any other things that we can actually do to recover from COVID, because obviously a lot of us got the disease, and a lot of us have had close friends or family members that got the disease as well. So obviously, this is some of the questions that we've had about COVID, and this is some of the questions that we've constantly had about what we could do, how we can completely recover, and whether and whether we can fully recover, especially after 2 to 3 weeks, or whether we will have to, or whether some of us will actually feel some of the symptoms of COVID after our recovery. So, I want to talk a little bit about the COVID symptoms and other effects and how to recover from it right now. Because, like I said, I want to have a little bit of a recap about. I want to have a little bit of a recap about COVID, especially because at the beginning, we were all aware of these things at the beginning, when the pandemic first broke out. We'd always have we would always have news channels, we would have radio stations always telling us about the different symptoms of COVID. But obviously, it's very important that we still remind people, that we still set out these reminders to make sure we tell people and make sure we keep people in check, and we keep people in check and still make them aware of the effects and the symptoms of COVID-19, right? So according to the info we currently have, or according to the information that we currently have about COVID-19, it's actually a respiratory disease. And like I said earlier, we'll be talking about the symptoms of this respiratory disease, right? So the most common symptoms of COVID-19 are actually fever, dry cough, and fatigue. Now, if you feel any of these symptoms, then it's always best for you to go get yourself checked, because that way you'll know if you have COVID-19 or if it's just a seasonal flu, or maybe you just have a sore throat. Basically, it's very, very important that you get yourself checked and make sure that you are aware of these symptoms that you have as well. Now, other symptoms that are less common and can appear in some other COVID patients are actually things like the loss of taste or smell, which is something very important. If you constantly feel like you've lost your sense of taste and smell, or smell, you can always make sure to go get yourself tested. Make sure to be aware of these things as well, because if you know someone who has lost their sense of smell or taste, or if you yourself are one of those people, it's always good to go and get yourself tested. Now, other things also include things like nasal congestion, red eyes, which is also called conjunctivitis, and a sore throat, headache, muscle or joint pain, different types of skin rashes, and nausea, and even diarrhea. Okay, so a lot of these are very common symptoms when it comes to flus, when it comes to viral flus especially. So it's very, I mean, it's not a surprise that you're seeing it in COVID-19 as well. So if you see any of these symptoms, if you know someone who's experiencing any of these symptoms, like I said, go get checked. But also, we'll talk about some other severe symptoms. This aren't always there in everyone who gets tested for COVID, but sometimes if it's a really severe case of coronavirus, you can have some of these symptoms, such as the shortness of breath, the loss of appetite, confusion, and persistent pain or pressure in persistent pain or pressure, right? So these are things that I'm just recapping, just to run through everything that we learned, just to make sure you have the correct information as well. Because like I said, ever since the pandemic happened, there has been a lot of disinformation, there has been a lot of rumors, and there has been a lot of fake news. So to actually combat all of that fake news, to make sure that you always have the correct information, I just want to run through these things really quickly. Okay, so that's what we're currently doing. And now, when we're talking now, since we've already spoken about the symptoms, let's talk about how long it takes for some of these symptoms to develop, and why you should quarantine yourself, and why it's so necessary for you to make sure you're isolated, or you're quarantined, right? So on an average, it takes about 5 to 6 days to develop the symptoms, but obviously it can range from 1 to 14 days as well. And what happens to a lot of people who get COVID-19, among those people who develop all these symptoms, or even some of these symptoms, about 80% actually recover from the disease without needing hospital treatment, but about 15% actually become seriously ill and require oxygen, and 5% become critically ill and need intensive care. So when you look at this, when you have an overall look at it, it doesn't seem too bad, because about 80% people actually get a full recovery, right? And because 80% of people get a full recovery, then that means it's not actually a lot to worry about. But sometimes, even though you do have a full recovery, even though the hospital discharges you, if you are hospitalized, or if you don't feel those symptoms as severely as you did when you were having the virus, it doesn't mean that you'll fully recover, because researchers found that sometimes you can actually experience some of these COVID symptoms up to 12 weeks, even after you've recovered. And these are things like fatigue, these are things like a sore throat, a cough, or even a cold, right? So these are some of the symptoms that you can actually experience, even though you've completely recovered from COVID-19, or you're supposed to be completely recovered from COVID-19. So, like I said earlier, about 15% become seriously ill, and 5% actually, 15% become seriously ill and they need oxygen, and 5% actually become critically ill and need intensive care. But right now, a lot of people, especially right here in the United Kingdom, a lot of people have got the disease, but a lot of them have actually recovered. We've had quite a number of deaths, but the thing is, right now things are beginning to look positive, especially with vaccination that is happening all around the United Kingdom as well. So obviously, we're making some progress. We're definitely, things are so much better than it used to be, because at least now we have some form of information, we have some idea of what the disease is like, and we have some sense of what we need to look out for, and what we need to do to make sure that we and the people we love are actually safe, right? So we'll also talk about the people who are at the most amount of risk, which is basically people who are aged above 60 years, and people who are aged 60 years as well. And even if you have underlying medical problems like high blood pressure, heart and lung problems, diabetes, things like that, obesity, or even cancer, you're at a higher risk of developing a more serious form of COVID-19. But we need to understand that even though people above the age of 60 are at a higher risk, that doesn't stop any other age groups from getting it, right? No matter what age you are, you can still get it, and sometimes things might even become quite bad, things might become quite critical. So obviously, like I said, even though right now there's a higher risk for people above the age of 60, it doesn't mean that there's less risk for all the people of other age groups right? um so when you get COVID-19, especially, we've seen when a lot of people got COVID-19, a lot of people can die, and that is what we're currently seeing in India as well. There's a really high death rate, and a lot of people are dying, and we've seen the chaos that was there. And it's obviously because there's actually a multitude of reasons as to why that's happening. Obviously, the healthcare systems are overloaded, they're having a huge influx of patients, and we need to understand that when we're talking about healthcare systems, COVID isn't the only disease that exists, right? Obviously, there are other patients in hospitals for different other types of diseases like cancers, or different body disorders. So many different sicknesses are there. So obviously, when the health systems are actually overloaded with so much of patients from one disease, it gets very hard for them to struggle, because like we need to understand, there's only a limited amount of health professionals, there's only a limited amount of medical help as well. And there's a lot of people, and actually, if you compare the amount of medical help available to the population of people, it's not really it's there's a huge disparity, or there's a huge inequality, or a huge gap between those two. So obviously there is a lot of influx, there is a lot of things like that when it comes to COVID-19. But having said that, a lot of people of any age group can actually develop the disease and can have a severe form of COVID-19, or they could even die at any age. It doesn't mean that just because you're younger that you're not going to die. You might have a less risk of dying, but that doesn't mean that the risk is completely eliminated, right? Now, let's talk about some long term effects of COVID 19, because this is something that I want to get into. Because when people actually experience other symptoms of COVID-19 after they fully recovered, it's something called long COVID, right? And like I said, a lot of these symptoms that they face are actually things like are things like fatigue, respiratory, and neurological symptoms, right? And they also experience things like a cough or even a sore throat, they muscle pain, joint pain, um, any symptom that is there in any viral flu. So these are some of the symptoms that they experience. But what we need to keep in mind, or what we need to understand, is that even if you've completely recovered, even if you haven't gotten it, it's always better for you to keep taking these precautions. It's always better for you to keep taking these preventive measures to actually make sure that all the people around you, or even yourself, is actually safe. Because like I said, even though the vaccination process is happening, even though the vaccination drive is happening, that doesn't mean that the entire population has been vaccinated, right? And we also need to keep in mind that certain research that has been conducted is only for certain age groups, right? We're still in the process of conducting research for vaccinations below the age of 12, and school children as well. And right now, people or children above the age of 16 and 18 have only been considered when it comes to vaccine treatments, right? So because of that, like I said, we need to make sure that we keep ourselves safe. Because if there are younger kids in the family, if you have younger siblings, you could potentially put them at a risk, right? So when the lockdown is lifted, if the lockdown is lifted, if we're heading out, it's always good to keep taking these precautions, because the government itself hasn't necessarily eased any of these precautions as well. We're still recommended to wear a mask. We're still recommended to maintain social distance. So like I said, it's very, very important that you keep these things in mind when you're heading out, and when you're trying to get things back to normal. So now we were just talking about the symptoms of COVID-19, why you need to get yourself tested, and whether you can actually fully recover from COVID-19. And we were just talking about long COVID, which is one of the forms of COVID that you can actually get even though you've completely recovered from COVID. Because researchers have actually found that even though you've completely recovered from COVID, you can actually have symptoms up to 12 weeks, and sometimes even longer, sometimes 6 months, 1 year. And there has been a lot of people that have got long COVID, who've had to deal with long COVID, and who's actually had to make sure that they've got a lot of rest to make sure that they're better. So make sure you stay tuned, because we'll be getting a lot into that. Because this also happens to be opinion, by the way. It happens to the fact that rest is definitely the recovery for COVID isn't a given, but it is something that people are experimenting. It's something that has helped a lot of people as well. So make sure you stay tuned, because we will get into that. But until then, let's head into a small break.
One of the easiest ways to increase your net worth is to ensure that you have higher cash flows. And one of the easiest ways to do that is to not buy things on hire purchase, not buy things over months and months because you can't afford them now, but you want it. It's kind of that delayed gratification. Rather than buy that couch, that car, that stereo, that computer, whatever item, and pay it off over 12, 24, 36 months at an interest rate, rather invest that money, make do with what you've got, and then after 12, 24, 36 months, take the money that you've now invested and buy that good. An asset could be anything that appreciates or reduces a tax bill. So it could still be a liability, but it reduces their tax bill. And I'm not going to go into the technicalities because that's out of our remit here. However, for our use or our purpose, what we are talking for the listeners here is I would put this definition of an asset forward. An asset is anything that increases your income. Anything.
Now, there's a lot of conversation around who pays more taxes, if it is the rich or if it is the poor, right? When you are basically going out and during a day, if you go to a restaurant, you have to pay taxes there. If you buy a car, you have to pay taxes there. So why is it even a conversation that, the rich pay less taxes or the poor pay more taxes? Why is it a conversation like that?
Because it's true that the rich generally pay less tax. A rich person walks into a Tesco's or a Sainsbury's, they're not going to get a different bill than another person, right? They're still going to pay the same VAT on those goods. They're still going to pay the same thing. So that's all the same. However, the differences come in if you can pay yourself from your own company, you can structure it in a way that you pay less income tax through paying a bit of salary, paying dividends, and so forth, and then also deferring income. Also, your pension payments or contributions can be different. So that increases your tax sort of gap, if you want to use it that way. Where a PAYE person just gets paid salary and bonus. And now those are the most highly taxed sources of income in the UK, definitely, in the UK.
Hey, it's a girl Sarah right here on the Kaleidoscope. You're tuned into Relaks Radio, and we're talking about if rest is actually the complete recovery to COVID-19. Now, I'm super excited to be here, and a very, very good morning to you. Welcome to the second hour of my show. You're with me, Sarah, and that is what we were talking about. Now, if you really like some of the content we talk about, especially things related to to the news, whatever it is based on finance, economics, health, science, we talk about everything. Okay, so if you really like the content we talk about, you can make sure you follow us on our socials, which is Facebook, Instagram, TikTok, and Twitter, and make sure that you keep yourself updated about what's happening right here on Relaks Radio, but also about what's happening all around the world as well. Now, if you have any thoughts, any opinions that you would like to share with us about about if rest is the way you can recover from COVID, make sure you text me on 07852 and you can get in touch with me and I can share your thoughts and your opinions with everyone who's listening in as well. So earlier we were just talking about symptoms. We were actually recapping things of the past year. We were talking about symptoms and talking about the people who had a high risk of getting COVID-19, and we were also talking about statistics and how much of people actually recover from COVID-19. So that's what we were talking about. But right now, let's actually get into long COVID, the after effects of it, and how to actually deal with it. Now, obviously, there has been a lot of research that has been conducted about the after effects of COVID, and there is a lot of research that has been conducted, but also research that is currently being conducted as well. Because obviously, given the fact that it's only been 1.5 years since we've been in this situation, it also means that we haven't really had enough time to research its after effects. We haven't really had enough time to research different things related to the pandemic. And that's why right now we're researching all of these things. We're investing a lot of resources to make sure we get good enough research and we find good enough solutions to all these problems that are currently there. So now, like I said earlier, researchers have actually found that sometimes, even though you've completely recovered from COVID, you can still have some of these symptoms, even though you've completely recovered from it, right? And sometimes, if you have mild symptoms, it's called mild COVID-19, or it's called mild illness of COVID-19, but it can still make you feel quite lousy, right? But the thing is, you should actually be able to rest at home, and you should be able to completely recover without being hospitalized. So that is something That is what it is when it comes to mild COVID-19. So if you're experiencing any of those symptoms, especially after you've recovered from COVID-19, well, that is nothing to worry about. Researchers conducted that this happens to a lot of people. About it happens to a lot of people, and it's not something that you need to be worried about. And it's not something that you need to be, anxious about as well either. But now there's something else called long COVID as well, which is basically when you have these symptoms, but they exist for a longer period of time, and that is from between 12 weeks to about 6 months to sometimes even a year. So the thing is, even though you've completely recovered from the illness, you can actually have some of the symptoms, and we'll see, or we'll talk about how you can actually have some of these. Right, like I said, COVID-19 is a respiratory disease, and we know that when it comes to respiratory diseases, that a lot of our lungs, a lot of the organs that we use for breathing, for respiration, actually gets affected a lot, right? And as human beings, we can't survive without breathing, we can't survive without respiration. And because of that, because we can't survive without respiration, um, we need to make sure that when we're getting back to normal, that our bodies are fully healed. Because for you to go back and do things the same way that you used to, you need to be able to breathe, right? Because, okay, like for you to run or for you to exercise, you need to have the proper flow of air, otherwise you're going to run out of breath, or you're going to faint, or you're going to get cramps, or whatever it is. A lot of these things you actually get because sometimes your breathing isn't regulated how it should be regulated. So like I said, because it is a respiratory disease, because it is something that affects your respiratory organs, it takes quite some time for them to actually heal, right? Because we're talking about our lungs, we're talking about these things that we use to breathe. When those things are attacked by a virus, that means that they tend to get more damaged, and they tend to take a longer time to heal. Because the moment you're recovered, you can't suddenly get back to normal, right? Even if it's any other disease, the moment you recover, you actually take about 1 or 2 weeks off to for your body to get back to normal, because all that energy that your body has been putting to fight that virus now needs to get back to normal, and it needs to rebuild some of the that energy it's lost, rebuild some of those cells that it's lost. So because of that, it takes a bit of time for you to completely get back to normal. Now that is why long COVID exists as well. It takes rest, it takes time for your body to completely recover, to get back to normal, and to build some of those some of those organs, or some of those parts of the organs that were that got broken down, or that got damaged during the virus when you first had it. Okay, so we're talking about long COVID, and we're talking about why it takes such a long time to recover from long COVID. Now, if I was to explain long COVID to you, it's basically this condition where people continue to they continue to experience COVID-19 symptoms for longer than usual after initially contracting the virus. And according to the World Health Organization, they explain that some people may actually experience long-term effects of COVID-19, regardless of whether they require hospitalization or not. And some of the symptoms of long COVID is actually are actually things like fatigue, respiratory symptoms, and neurological symptoms. Basically, things like difficulty in breathing, getting tired really easily, having a lot of joint pains, sometimes having difficulty in breathing, right? So these are some of the symptoms of long COVID, and this is what happens when when you first get COVID and you're not completely recovered from it. And a 2020 survey that was conducted by the CDC, which is the Center of Disease Control and Prevention, suggests that sometimes it may actually take weeks for COVID-19 symptoms to resolve, and for people to return to their usual state of health. Now, sometimes it doesn't matter how healthy you were before you got COVID-19. Even if you were someone that went running every day of the week, and you did multiple other sports like boxing, swimming, yoga, whatever it is, even if you did all of these sports or exercises, that doesn't mean that as soon as you recover, you can suddenly get back to it, because you need to understand that when it comes to exercises, when it comes to sports, you actually, there's a lot of physical exertion that you put into it. You get exhausted after a while, because it is a lot of work. All parts of your body are working, your muscles are working, so obviously your body gets very exhausted. So it doesn't matter how healthy you were before COVID-19. The moment you get it, and after you get it, you should take a little bit of time off and you should rest, um, to make sure that things don't get bad, and to make sure that it doesn't develop into something else. And this is also very applicable and relevant to young adults who have no chronic medical conditions, as what I was talking about. Even if you're completely healthy and you had no chronic conditions, well, then you still need to rest. And data from the United Kingdom's Office for National Statistics actually found similar results, with roughly 1 in 10 correspondents actually who tested positive for COVID-19 exhibiting symptoms that lasted for a period of 12 weeks or much longer. Now, this is what I was telling as well. 1 in 10 people actually have these symptoms for a time period that is sometimes 12 weeks or longer. And when it comes to who is more affected from long COVID, it is more likely to occur in older adults, and sometimes people with a higher body mass index, which is a higher BMI, can actually also have a higher risk of getting long COVID. And sometimes even women or people who identify as female can actually have a higher risk of getting long COVID as well. So now we've spoken about long COVID, right? And we know that these are the symptoms. We know how often it happens, and we know which kind of people are at risk of getting long COVID, right? So we'll also now talk about if you can recover from it, and how exactly you can actually recover from long COVID, right? Now, some of the things that I found on how to recover and how to actually get better from long COVID is not something that is necessarily that it has necessarily been verified by doctors, but it is something that doctors commonly recommend. We've all been asked to rest after we get a sickness, right? And that is what I'll be talking about as well, because we'll be talking about if resting is actually going to help you with all of these illnesses that you face, not just COVID, but also other illnesses as well. And we'll also talk about you know if these symptoms will, or if getting rest will actually help, or whether that will actually help in any other form of research as well. But right now, let's head into a small break, and then we'll actually quickly get back to talking about COVID-19, and if we can actually recover from COVID-19 just by resting at home. Hey, it's your girl Sarah right here on the Kaleidoscope. You're listening to Relax Radio, and we're talking about if recovery, or rather, if rest is the way to recovery when it comes to COVID-19. So that's what we were talking about. And earlier, we were just talking about the various symptoms of long COVID-19 of long COVID rather, and how it's actually going to or rather the people who are at a higher risk of getting it. Now, some evidence also, or rather, it has been noted that some individuals who experience more than five symptoms of COVID 19 when they initially contract it are actually much more likely to develop long COVID. And another thing that needs to be kept in mind is a lot of health workers out there have been dealing with COVID-19 patients. They have been handling COVID-19 patients, and sometimes because of that, they've contracted the virus as well. So, some evidence actually shows that healthcare workers might actually also contract or show some symptoms of long COVID and might have to deal with long COVID because of the fact that that they're healthcare workers, and they're constantly in there, they're constantly looking after all these people. There's sleep deprivation, they don't really have enough of rest because of the huge influx of COVID-19 patients. Right now, possible causes of long COVID actually may include things like a reduced or lack of response from the immune system, because like I said, when you have a virus, your antibodies or your immune system is fighting really hard to make sure you don't get it again, right? So obviously, because of that, because it has been working so hard, maybe in a few more weeks, they will eventually reduce the amount of activity that they have, just to make sure that your immune system is trying to go back to normal, right? And sometimes you might even have a relapse or a reinfection of the virus, which is another possible cause of long COVID. And inflammation or a reaction from the immune system, like I said, when your immune system is constantly working, it might react, or it might even include in your organs, or even some parts of your body getting swollen, because they're constantly overworking themselves to make sure that they keep you safe. And when you get COVID, or when you're sick with COVID, something that you obviously do is you rest in bed, right? This means there's going to be quite long periods of inactivity, which is something actually referred to as deconditioning. So because of deconditioning, sometimes because your body is going to be inactive for quite some time, because your body organs, and even your cells, they need to recover from COVID-19, that might actually be a cause as to why you actually end up with long COVID. And some research actually indicates that lingering problems associated with long COVID may actually be the result of injury to multiple organs, which are things like which are organs like your lungs, your heart, and your brain. Because even though it's a respiratory disease, as we progress further into research, and as we are researching more and more things about COVID-19, we've actually found out that it doesn't always only just affect your respiratory organs. It also affects your heart, your brain, and sometimes and your lungs, obviously. But we've also found out that it can affect your brain and your heart. So because of things like that, because your other organs could also be damaged, simply because of how severe your COVID symptoms are and how severe COVID is for you, it can actually result in you getting long COVID. So, having said all of that, obviously the one question that we all have is, do we then completely recover from long COVID as well? Is we've already recovered from COVID-19, so then how do we actually recover from long COVID? And the opinion of one of the people who actually had symptoms of long COVID, and someone who is also an independent journalist who actually connected with a lot of people who were experiencing a lot of long COVID symptoms, was actually Fiona Lowenstein. And she said that the way it helped her was actually through rest. Now, like I said before, doctors always recommend rest when you're going through some form of sickness, right? Be it a viral flu or any other disease, doctors always recommend that you get as much rest as possible, because when your body is constantly overworking, it also needs time to relax and come back to normal. right? And like I said, the moment you recover from a disease, you can't actually get back to normal. There's also the gap period where you sort of, or that grace period where you take a little break, you try to get things back to normal, and you focus on yourself, and you try to do as little as possible so you don't get tired easily. And that is what you do with any disease, right? So that is the same thing that needs to be done with long COVID-19, that needs to be done with long COVID as well, right? So what she did actually was she devised this whole schedule where she tried to take like the maximum time possible to do certain tasks. And how that helped her was she wasn't in a hurry to do this. She wasn't always in a rush to finish certain tasks at a certain time. And this actually allowed her to take her own time and do things, and eventually let her body rest and do things really so slowly. Because when you especially in the middle of a pandemic, once you've gotten the disease and you've gotten rest, it's very hard for you to or we find it very hard to keep continuing that rest, right? Especially if you're the primary caregiver, or if you're the breadwinner of a certain family, and you need to get back to work, right? Because you need to make sure that everyone else in your family has enough money, everyone else in your family has enough has enough resources to survive with. So then in instances like that, you have no choice but to actually make sure you can get back to work as soon as possible. But the thing is, when it comes to long COVID, you need to make sure that you can get enough rest as much as possible. And so while this is actually, some people actually have the privilege of doing it, this is not so for everyone. This is not so for everyone else who has long COVID symptoms, right? But we'll get into that in a few more minutes. But right now, I want to talk about how resting actually helped her and a lot of these other people that she was in contact with as well. So what she did was actually she devised this daily schedule where she had certain, a few number of tasks that she had to complete for a day. It would be something like brushing her teeth, or even making herself something small to eat, and then she would spend the rest of the day sleeping. And sometimes she would try to do work, but it wasn't for a long time. It wasn't like 8 or 9 hours of work. It was just 2 to 3 hours of work. So she puts in the least amount of effort as much as possible. But what she noticed was, even when she did work for such a small time, it actually caused her body to crash. And then she would be unable to do anything, and she would just have to sleep for the whole day to make sure that she would be okay the next day. So she also continued doing this because she realized that it worked out for her, and then she decided that she'd give up her job so she could get some rest, and she could focus on herself and focus on getting better. Now this is why I'm going to talk about privilege and financial difficulties, especially if you're from a low income family or a middle income family, and you're the primary caregiver, or you are the breadwinner of the family. You don't necessarily have this privilege, and that is because you have to constantly make sure that the people you live with or the people you support have resources to survive with. So then we also begin to understand that when it comes to long COVID, even, it doesn't even have to be long COVID. When it comes to any sickness, sometimes a lot of the people who can survive, a lot of the people who can actually or have the time to rest, are actually people who have financial privilege. And that is not a lot of people out there, because there's a lot of people out there who don't have that same amount of financial privilege. Now, Fiona could actually stay at home because she had earned enough money, she had enough savings, and there were other people who could actually support her while she stayed at home. But that's not the case for everyone. And she, she was saying how it's very, very hard for a lot of people out there to survive, especially when they have long COVID symptoms, but they constantly have to be working as well. And sometimes this actually causes them to relapse into that state, to get that infection all over again, because they're overworking themselves. And given the fact that if you do take a break, or if you're given a break because you contracted the disease, you still need to catch up on all that work that you missed out on while you were sick, right? So obviously this means that you need to put in extra hours. This means that you need to keep working the same way you used to. If anything, you have to work even harder to make sure you can compensate for all the work that you missed, right? So because of that, she was saying, and because of that, we also like begin to see how much of how the wage inequality affects people in general. Right now, I was talking about this some time back as well. I was talking about how COVID-19 actually exacerbated the gap or the wage inequality that exists within society. And when things like this happen, you can just see it so much more better, because we begin to see how much this wage inequality is actually affecting people, is actually affecting lives. So but if we were to actually talk about wage inequality and everything else you could do to fix that, that's a whole conversation altogether. So maybe sometime later, but not right now, because we're talking about if resting can actually make sure you get a full recovery from COVID-19. So while she was actually resting at home and she was trying to get as much rest as possible, she also began to connect with people who suffered from chronic fatigue syndrome. Now, the chronic fatigue syndrome is basically, after an infection, how millions of people are actually how millions of people actually deal with the fact that they're always tired, that they're still trying to get back to normal. Right now, she also, and something she said that she found out when she was doing this was actually the fact that a lot of research when it came to the chronic fatigue syndrome was actually very underfunded and unrecognized. And because it was very underfunded and unrecognized, it was very hard for them to actually get help, because what a lot of doctors would say, or what a lot of health consultants would say was, oh, it's normal, but eventually you'll get over it. But because of the fact that it's heavily underfunded and it's also hugely unrecognized, that means it also has a huge disadvantage when it comes to people from low income or middle income families, right? And especially when you don't have that financial privilege, especially when medicine or even health itself doesn't support the fact that sometimes you might have this syndrome after a a severe illness, it means that chances are it's going to be really, really hard for them. So obviously, because of that, that is why it was very important for us to actually talk about if resting is the way to completely recover from COVID-19. Because when Fiona actually connected with all of these people and she was talking to them and asking them about how they dealt with it and how they managed to recover themselves from it, what they said, a lot of them, they said that they rested, and a lot of pacing helped them out. Now, pacing is basically when you only do a certain amount of tasks for a day, and you try to pace it out as much as possible. You try to spread it out throughout the day, so you don't exert a lot of pressure, or you don't tire yourself a lot. That is what pacing is. And she said, and a lot of these people also said that that is what helped them out. So obviously this is what she did as well. And research also shows that sometimes resting, getting as much rest as you can after a sickness, will actually help you recover. So this is something that we need to think about. This is something we need to consider as well. And also, this is something that businesses, companies will need to consider, especially when we're trying to adjust to a world that a post-COVID world. When we're trying to adjust to a world after the pandemic, when we're trying to adjust to people feeling all sorts of different things. Because like I said, we're still in the process of researching. We're still not completely done researching, and we're still in the middle of a pandemic. We haven't even reached the final stages. There's so many things that is still unknown to us, and so many still things that we still need to look into. So obviously, when it comes to instances like that, it's very, very important that we still keep researching, and we keep trying to fund these research as well, to make sure that we can get as much information as possible about the pandemic. But make sure you stay tuned, because I'll be back in a few more minutes to actually talk to you about whether we can actually forgive and forget, and how to do that. So make sure you stay tuned. But I'm gonna be back in a few more minutes. So stay tuned, because I'm definitely gonna come back here and tell you a lot of other interesting things.